There's so much information out there, right?
Mm-hmm.
It's like an avalanche at age 65. Again, the joke that I've historically made is if you knew you would be this popular at 64, you wouldn't have tried so hard in high school, right? Like they're just getting phone calls and mail, and they're getting stuff from their brothers, their sisters, their neighbors, their peer groups, right? And unfortunately, in that avalanche of information, there's also a lot of misinformation. And that's where I really think we come in. Well, welcome to the MediConnect Medicare Made Simple Podcast. I am Lance O'Brien alongside Sean Horne. Sean, you look a little tired, buddy.
We're in the throes of the annual enrollment period, and my friend, we have been very busy, very productive, very helpful to a lot of people, but it is grind time right now.
Yeah, it really is. It's hard to believe we're almost getting to the end of it. But aside from the annual enrollment period, as you know, and I know, and hopefully the folks that are listening today will realize, is that the education of Medicare is super important to us. You and I have talked about it many times before. There's so much information out there, right? Mm-hmm. It's like an avalanche at age 65. Again, the joke that I've historically made is if you knew you would be this popular at 64, you wouldn't have tried so hard in high school, right? Like they're just getting phone calls and mail, and they're getting stuff from their brothers, their sisters, their neighbors, their peer groups, right? And unfortunately, in that avalanche of information, there's also a lot of misinformation. And that's where I really think we come in.
Yeah, I mean, so you figured in southwestern Pennsylvania, where we're broadcasting from right now, 67 Medicare Advantage plans in our market, 15 different drug plans. There's many different Medigap providers and plan choices that you can make inside. So it's just a lot of information. And from October 15th through December 7th, I counted it out. There are 38 business days. So if you take out the holiday of Thanksgiving, you take out weekends, that's a very truncated time frame to make a very big decision. And, you know, why we've been so busy this enrollment period is because of what's happening around prescription drugs and how there's massive changes happening there, which is a lot of them are good for the consumers, but there's a rippling effect that are happening all over across the benefit guidelines and breakdowns that they're providing. And as a result, what we're seeing now is even advisors in our industry who don't work at MediConnect, but we're seeing that they're even confused by all of this and how to make sense of it all. So, you know, if you're looking to engage with experts who can make Medicare simple, hence the name of our podcast, and, you know, really, as you would like to say, and I love this phrasing, you want to put the cookies on the bottom shelf. Make it easy for people to really wrap themselves into the conversation so they can make a confident decision related to their coverage where they know they're comprehensively covered and in a cost-effective manner. And the easiest way to do that is just boil it down, make it simple, and eliminate all the static and noise.
Yeah, so to that end, you know, we have over the years said, how can we get this information in front of people in a way that is very easy for them to digest, right? So a number of years back, probably 4 or 5 years ago, a little bit after we started our Saturday morning radio show, we started doing in-person seminars, right?
Feels like a lot longer.
It most certainly does, but all over the city, different quadrants, you know, towns, and we would go in an hour, we would really walk people through what is Medicare Part A, what is Part B, what do they cost, what do they cover. We would get into how to avoiding penalties, what is a Medicare supplement, what is an Advantage plan, what about Part D, which is prescription drugs. Like that's what the seminar was, and we've had incredible results from that over the years, correct?
Yeah, we have. I mean, we filled up a lot of rooms all over the 4 quadrants, as you talked about, north, south, east, west. We're going to many different communities all the time, coming to their neighborhood to show that we're easy to engage with so that you can get the information you deserve. Again, has been a staple of our success, if I might say, over the last 5 or so years. And, you know, we got to meet a lot of great people and host in a lot of different communities, but we're also living in an on-demand age. I think that's fair to say. Podcasts,
streaming,
podcasts. We want everything when we want it, instead of having to set our TiVos or record at this time. And as a result, we're seeing a little bit of success with a new endeavor that you and our new marketing team have put together for us, where we're doing a lot of webinars now to make this easier to engage within. Because again, a lot of people are still working at 64 years of age, coming to these events after work. So you just been in a cubicle for 8 to 10 hours. Now you're going to go to an event where you have to hear about Medicare for an hour. It's a draining day, right?
Right.
So now people are going to be able to engage on their timeline so that they can get the necessary information to make clean decisions.
Yeah, and I think that's huge. So again, we're going to continue our in-person seminars. I mean, we're near the end of 2024 right now. We have about 100 in-person seminars that are already getting on the books for next year. So we're going to continue to do that because we do realize that there's still a lot of people that want that in-person feel. But what we've also learned over the last 3 months is there's a growing population that really does want that ease and flexibility. And right now we're doing bi-weekly webinars. People can go to our website. They can register right there on our seminars tab. There's a webinar button. You just click that. They're able to register, get in for the next webinar. And we're going to be moving to weekly webinars next year.
That's awesome.
Yeah. So, and again, the turnout, I do that in quotes because they're actually hopefully sitting in their jammies with a nice latte and a donut in their living room watching the webinar, but it's the same information. And again, we've had double to triple the amount of people at the webinars, even though we're still getting 15 or 20 people at the seminars, right? So we're getting great turnout, and it's been awesome to be able to see the people engage with us this way.
Yeah, I mean, I think if there's anything good in our industry that has come out of a pandemic is the fact that people have become a little bit more used to being remote.
Yeah.
So being able to get the information you deserve in an environment where you're most comfortable at the pace at which you can set probably is going to be very helpful to a lot of people. Again, the classroom setting that a lot of people do engage in currently, again, you just talked about, it's not going away. We just want to enhance and build upon it for those who, can't make the trip when we're going to be in the North Hills one week and, they live in the bottom of Washington County or whatever it might be, right? We want to just do what we can to make things convenient for our audience.
Yeah, and if they can't make it to the live webinar, the great thing is we record every one of them. We send them out to them that same day. So it really does give that on-demand, in-the-moment feel. And then the great thing is that we are able to follow up with them and still setting the appointments. And I think the beauty of the webinar system for us is we have the structure to support it. And what I mean by that is it's not just the information that we're conveying out, but we have a live call center. We have people that, and it's one of the only ones in the whole area, right, that will provide that. We also have a great team of field agents, right? We have a client experience department that follows up after the initial enrollment. So we have the entire structure in place that is helping them from where they're like, I know I got to go on Medicare. I don't know what to do. I'm frustrated. I'm fearful. All the different emotions that come with it. And we're really just trying to completely simplify this. And that's why we wanted to talk about this today, was because if you're looking to get the best information from the top rated advisory firm in the whole state of Pennsylvania, MediConnect is where it's at when it comes to Medicare information. And now it's not just live in-person seminars, it's the webinar as well.
So you're saying that when somebody is new to Medicare, they can go in person or they can go virtual. We have the ability to help people with our CMS approved telephonic call center, which is internalized to MediConnect. We don't go outside the country like other organizations do. They are employees of our establishment here. So we have that working. We also have a dedicated field unit which will come to your house if you want, or we can meet at a third-party location like a bakery or something.
Or they can come to us.
Or they could come to us. I mean, I don't know that a lot of people realize that our industry and our competition, if you will, if you want their help, you have to go to their office. Or if you want their help, you can only be assisted over the phone. You don't get that personal feel. If you want that, you don't get it in a lot of these other organizations. So we're trying to make ourselves flexible, obviously, through the webinar process where you can get the information as you need delivered to you. But afterwards, when it comes to servicing your needs on an individual basis to make sure your coverage is keeping up with your prescriptions and your healthcare and your demands otherwise, we have the means to be able to help people through that process.
Yeah, and I think one other thing we really need to define in this podcast today is a lot of times we'll get the question, am I too early? Am I too late? Right? Because there's not really a guidebook on when people should start the process. And for us, just in our years of experience of doing this, we know that 12 months is kind of the sweet spot, right? 12 months from the time that you turn 65, you want to attend our webinar, you want to attend one of our seminars, you're going to get all that information that's going to help you begin to absorb the Medicare process. Maybe you're going to keep working. We're going to help you kind of figure out, is even in working, is your group coverage better, or is Medicare going to be a better option for you? So we're going to help you set up timeline. We're going to help you set up budget, right? So again, if you're listening today, or maybe you're thinking about your parents as you're listening, or another family member, 12 months out from turning 65, that's really the sweet spot of wanting to attend one of our webinars or one of our in-person seminars.
And you bring up an interesting point there, because I was actually engaging with us on our radio show this past weekend where I was hosting, took a phone call from somebody who is working still, covered by their group plan, 68 years old, but has Medicare Part B.
Oh, right? That just makes me sad.
It does, because unnecessarily.
Unless they have less than 20 employees, right?
Oh, they do not.
Yeah.
The name of the company is very big in our region.
Okay.
So the unfortunate part is, they've been paying for Medicare Part B without a need to, just because she didn't have that proper guidance on, do I really need this, or can I put it off? And if I do put it off, will I get a penalty? That's what we specialize in. That's
a $10,000 mistake right there. And that's what we're here for. We don't want you to make a $1 mistake, right? We want to make sure from point A to B, you're completely solid in the decisions that you make. And she probably heard from someone, because we hear it all the time, if you don't sign up for Medicare at age 65, you're going to get a penalty. So she did it based off of hearing that. And that answer to that question is maybe. And that's why people need our information so much.
Yeah, I mean, it really comes to, I always say that Medicare is like your fingerprint. That's the part of it that keeps it interesting for me anyways. And I've been doing this long enough to where we know the ins and outs of the federal program really well. We know the benefits available in our market extremely well. But your unique set of circumstances and how we could put that puzzle together in front of you based off of what you need, that's really what keeps all of this interesting and gets us out of bed every single day. Because again, Medicare is not enthralling as a subject matter whatsoever. I think we'll all agree to that.
It's not?
Right? It's really not. It's really not. Look, if you want to be put to bed, read the Medicare New Booklet.
There you go. I agree with that.
It'll knock you out like that, but at the end of the day, we know that this is an area that a lot of people need a lot of help. And it's very easy to make a mistake if you don't get the expert guidance.
Totally agree. So we appreciate you taking a few minutes today to join us for this Medicare Made Simple podcast with MediConnect. Again, new to Medicare, next 12 months, you need to attend one of the seminars, or now you can go to the webinar. Both of them can be accessed on our website, MediConnectInsurance.com, clicking on the seminars tab, or you can call 888-818-6334.